And now, please clear the aisles and take your seats, and welcome the class of 2016.
UB Councilmember Hayflick, Provost Zukoski, Vice Provost Dunnett, Vice Provost Granfield, Vice Provost Hamill, Vice Provost Melvin, Vice Provost Miller, Vice President Kane, Dean Witkowski-Wendy, members of the Platform Party, and honored guests. The graduates, candidates for degrees, faculty, staff, and the parents, families, and friends of the graduates and candidates are assembled. I hereby declare this commencement of the School of Public Health and Health Professions to be open.
Good afternoon, everyone, and welcome. I'm Jean Witkowski-Wendy, Dean of the University of Buffalo School of Public Health and Health Professions. It's my pleasure to welcome you all to the 14th commencement program of this school. I would like to introduce Christopher Wittig, who will lead us singing the national anthem. Please all stand.
What so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you, Christopher. Can everyone please be seated? I am now very pleased to introduce Leah Panic Shirley, who, as one of our graduates today, will offer a welcome to help begin today's ceremony. Leah will receive her doctorate in exercise and nutrition science today.
Thank you, Dean Witkowski-Wendy. On behalf of the class of 2016, I want to welcome our friends, family, colleagues, and my fellow graduates. It is with great honor that I am opening today's ceremony with a salutation to this amazing class in the School of Public Health and Health Professions. We are amazing because of the many diverse roads we each took to arrive here today. We got here without any specific directions, map, or plan. On our journey to this day, some of us stopped to enjoy the scenery every chance we had before continuing onwards. Others of us encountered what seemed like every roadblock, speed bump, and detour. However, we continued on this sometimes circuitous path, which brings us here today. Throughout our journey, we ran, we walked, we crawled, and we traveled together. Most importantly, at this stop on our journey, we are all here today, collectively, as the next group of health professionals ready to undertake our common task of improving the quality of life of those around us. We have been given the tools to shape our future any way we desire. We had extraordinary influences and support systems in our lives that helped guide us in the right direction during our journey. This would, in part, be due to the brilliant and supportive minds sitting behind me, whose collective passion for teaching and scholarship have paved the way for us to be successful in our own right. Most importantly, we are here today because you, our spouses, our families, our friends, and our colleagues have sacrificed for us all sitting here to see us walk across this stage today. We have the knowledge, the direction, and the resolve that got us here to this point. But what will we do moving forward? What will it take for us to move to the next level and elevate us to excellence? Answering that question will take us further along on our journey with new challenges. But seeing all of you in front of me, I know we are up for that challenge. Congratulations to the class of 2016. Let commencement officially begin. Thank you.
Thank you, Leah. It's my pleasure to introduce several special guests today. I ask each of you, when your name is called, to stand. Please hold applause until we have all been introduced. First, Member Emeriti of the University of Buffalo Council and UB alumni, Ms. June Hufflick, Vice Provost for International Education, Stephen Dunnett, Vice Provost for Faculty Affairs, Robert Granfield, Vice Provost for Graduate Education, Graham Hamill, Vice Provost for Enrollment Management, Lee Melvin, Vice Provost for Equity and Inclusion, Teresa Miller, Vice President for Health Sciences and Dean of the School of Medicine and Biomedical Sciences, Michael Kane. Today, we are especially honored to have with us Provost Charles Zukoski. Provost Zukoski will confer degrees and offer remarks. Please welcome Provost Zukoski.
Wow, this is superb. I'm very pleased that we are here together celebrating the 2016 School of Public Health and Health Professions Commencement. I'm always thrilled to be at graduation ceremonies with you, the graduates, your friends, family, and the university community, where we celebrate your exceptional achievements to date and eagerly anticipate what you will accomplish in the future. As one of the nation's leading public research universities, UB has a mission of creating new knowledge and communicating this knowledge to you, the next generation of leaders, researchers, professionals, and citizens. We take seriously our responsibility to improve the human condition through our scholarship, our clinical care, and our engagement. As UB students, you have gained from that commitment. You have learned from the most respected practitioners and thought leaders in their disciplines. This education is informed and enhanced by the research undertaken by our outstanding faculty. You have been partners in the process of seeking and using knowledge and understanding of these individuals to build a better world. This partnership occurs in the classroom while working together in communities, in labs, and in conducting research. Graduates, you have developed deep domain knowledge in public health and health-related fields and put this knowledge into practice in communities around the world, in labs and through clinical experiences. You have provided health care to and improved health outcomes for our local and international communities. You have participated in interprofessional education as an essential element of the healthcare team. You have taken advantage of the research opportunities offered by our top-ranked public health and health professions programs. Just as importantly, you have worked hard. You have gained exposure to ideas and culture, history, science, and technologies, and had meaningful interactions with your peers and professors. These are the experiences that shape your unique perspective and way of approaching the world. It is this distinctive combination of classroom and clinical learning, team building, and out-of-class experiences that enable you to develop the creativity, the empathy, the leadership skills that are needed to succeed as healthcare professionals, as teachers, and as thought leaders in public health and health professions. With societal shifts towards preventive and personalized medicine and new challenges emerging as people live longer and differently than in previous generations, healthcare professionals will have to be responsive to new challenges and needs of the future. Your UB education has prepared you to be flexible, to apply your knowledge and skill in different ways and to meet the new challenges head on. These are the attributes that will assure you of your success in the future. I wish my sincere and heartfelt congratulations to our 2016 University at Buffalo School of Public Health and Health Professions graduates. We are very proud of what you do and have great expectations of what you will accomplish in the future. Congratulations.
Thank you, Provost Zukoski. Today is a celebration that recognizes all the accomplishments of the graduates in this room. Let me start by offering my personal congratulations to all of you. As we confer the degrees today, I ask you each take a moment to reflect on your achievement. Today we confer on you a college degree, a tangible achievement that you are able to proudly claim for the remainder of your lives. The degree represents knowledge and experiences that will help guide you as you move forward. Some of you will start your careers, others may be moving on to obtain additional education. Regardless of your path, know that you will be able to use what you have learned here to support you as you move ahead. It is your hard work and perseverance that has gotten you to this point. However, for many of you, the support of family and friends was important in achieving this milestone. This hall is filled with many friends and family members. As a means of thanks, I ask the graduates to stand, turn to the audience, and offer a round of applause to your supporters. Longest applause of any class so far. In addition, behind me on this stage are members of the faculty who have taught our graduates. Let us acknowledge their contribution to our students' education and for their mentorship over these past years. Please join me in applause for the faculty contributions. We have a photographer here today to capture pictures of this event. We will be posting photographs from today's ceremony on our webpage for everyone to enjoy. Please stay connected with our school and the University of Buffalo as you move forward. You can do that by being an active participant in our Alumni Association. Be proud of your school and the education you received here. Go on to the world, do good things, and use your education and training to contribute to creating a healthier society. Be proud of all you have accomplished. You have earned it. I now have the special honor to introduce this year's commencement speaker, Dr. Helene Gayle. Dr. Gayle is an internationally recognized expert on public health, global development, and humanitarian issues, who has dedicated her career to helping improve the lives and health of millions of people around the world. Currently Chief Executive Officer of the McKinsey Social Initiative, nonprofit organization dedicated to addressing complex global and social challenges. Dr. Gayle has focused her career on several primary areas such as combating HIV/AIDS, empowering and improving opportunity for girls and women, and eradicating global poverty, illiteracy, and illness. A Buffalo native, Dr. Gayle has had a profound impact on global health issues both in her hometown and around the world. She served for more than 2 decades at the Centers for Disease Control and Prevention and was appointed as the first director of the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention. Dr. Gayle achieved the rank of Rear Admiral and Assistant Surgeon General in the U.S. Public Health Service and is a former chair of the Obama administration's Presidential Advisory Council on HIV/AIDS, as well as the former president of the International AIDS Society. As president and chief executive officer of CARE USA, Dr. Gayle led an international humanitarian organization to fight poverty through programs that have impacted more than 82 million people from 87 countries around the globe. In her current role as the inaugural CEO of the McKinsey Social Initiative, Dr. Gayle is developing new partnerships with public and private sectors to tackle global challenges such as youth unemployment, gender inequality, and health disparities. Please join me in welcoming Dr. Gayle.
Good afternoon, and thank you so much for that wonderful introduction, Dean Witoski-Wende. And also, I'd like to give my thanks to all the distinguished individuals who are here on stage with me who've committed their careers to making days like this possible. And I'm also very, very pleased to be joined by several of my family members who are here today, who continue to live in the Buffalo community. It's wonderful for me to be back here. And it's a real honor to be speaking at the School of Public Health and Health-Related Professions. As a native of Buffalo, it gives me such great pride to be here and see all that this school has done. We were talking earlier about how the whole medical campus and health campus has really changed and is transforming this city and making such incredible contributions to the field of health and medicine. So it's really a real honor for me to be part of this. It's also hard for me to believe, and we were also talking a little bit earlier backstage about aging and how everybody's living longer. So it's hard for me to believe that I was 10 years old when this school was created. That was back in the 1960s, at the height of an incredible period of social change in our society. And I think as a result of that, I really developed this commitment and passion for social justice and looking at how we can use our lives to make a difference. And so your commitment to improving the health of everyday citizens is really keeping with that whole spirit of social justice and activism. It's also why graduations are always a bit of an emotional time for me. It's hard not to be moved by the incredible and awesome sense of new beginnings and the possible. And seeing all the families who were recognized earlier, who've poured your hopes and your dreams and your checkbooks into assuring that all of you succeed. So graduations, I think, are a very human moment. And for me, it's also deeply moving to be here with you today. As a pediatrician and a public health physician, I'm especially inspired to be speaking to a graduation where every single graduate intends to leave for a career that involves improving the health for individuals, for communities, for nations, and in fact, for our world. Seeing so many talented young people dedicated to healing affirms my belief that our task is to leave the world a little bit better than when we entered. Now, many people have expressed that sentiment in different ways, but I like the version that Congresswoman Shirley Chisholm, who was actually the first African American and the first woman to run for the Democratic Party's presidential nomination. She said, "Service is the rent we pay for the privilege of living on this earth." Ms. Chisholm is buried here in Buffalo, and I think you here today are part of the mission that she believed in. So let me say a few words about that mission. Today, the issue of inequality is on everybody's lips, from politicians to the Pope. Around the globe, the number of billionaires has more than doubled in the last 7 years, and the top 1% make more money than the rest of the human race combined. Here in Buffalo, roughly 1 in 3 people live below the poverty line, but we know that thinking just in financial terms totally underestimates the complexity of the problem of inequality. Inequality of all kinds impacts health and is one of the major contributors to poor health in our country. If you make less than $35,000, for example, you're about twice as likely to have stroke, emphysema, ulcers, or bad vision as if you make more than $100,000. And you're more than 5 times likely to suffer from depression. And we know that our legacy of racial inequality and discrimination cuts deep on health outcomes. Black infants in America are more than twice as likely to die as white infants. Latino children are twice as likely to suffer from asthma. Black women are 20 times more likely to contract HIV than a white woman. And while we spend more for health than any other high-income country, our health outcomes are worse, with the lowest life expectancy in comparison to countries like Europe, Australia, and Japan. But these very health costs can also punish families who are already financially insecure. We all know families or have read stories of families with medical costs that have pushed them into financial ruin. So poor health is both a consequence and a cause of financial inequality. But comparative statistics like these can make it easy to identify the inequalities, but they also can make it easy to sanitize them. We sometimes get caught up and our eyes glaze over when we hear numbers after number. But the stakes are not just numbers on a page. The stakes are bad things happening to real people. A healthy person is not necessarily a happy person. We know that. But an unhealthy person is robbed of a chance to thrive, to dream, to fulfill her potential. So given the link between health and broad inequality, by confronting these statistics, by dedicating yourselves to giving all people the opportunity to live the lives they want, you can be champions to fight for justice, fairness, and equity around the world. The good news is that we have more resources at our disposal to address these inequalities than we've ever had before. The Affordable Care Act means that more Americans are getting more health care than in any other time in our history. And our knowledge about how to provide excellent care is accumulating rapidly. We know more about what causes diseases, and we know more about how to diagnose and treat them than ever before. And we're learning more about the interplay of social and economic factors that impact health and health outcomes, like education, housing, and the built environment. So we're creating a better focus on the broader definition of health that goes well beyond just treating illness, but about how do we make sure that people have the right to health more broadly. So I think this amounts to a real opportunity. And I think you have the opportunity to bring these immense resources to bear on the massive disparities that prevent our country and our world from delivering on the promise of justice for all. So how will you seize this opportunity? When I was at the Centers for Disease Control, I was fortunate enough to work with one of my public health heroes, former CDC Director and former Surgeon General David Satcher, who went on to found the Satcher Health Leadership Institute. Their motto is, in order to eliminate disparities in health, we need leaders who care enough, know enough, will do enough, and are persistent enough. Now, I know that each of you are going to find your own way to serve, but in considering your path, I invite you to think seriously about these enoughs. One that I know you've already thought a lot about is knowing enough, or you wouldn't be here. You understand that getting a degree gives you the opportunity to make a big difference in your life, so you know a lot about knowing enough. But let's take a moment to think about the other enoughs. What does it mean to care enough? What does it mean to do enough? And what does it mean to persist enough? First, care enough. The best story that I know about caring enough belongs to former President Jimmy Carter, who mounted a vigorous campaign in his post-presidential career pursuing the eradication of drocunculiasis, or guinea worm, a disease that's been around so long that there's references to it in the Old Testament. In 1947, an estimated 48 million people worldwide suffered from guinea worm. In 1986, with President Carter's help, that number was down to 3.5 million cases. But more than half of them were in Sudan, where a civil war was raging for decades and had prevented eradication workers from reaching much of the country. But neither President Bashir in the north or John Garang, the leader in the south, was willing to compromise their terms for a ceasefire. So Carter scheduled a meeting with President Bashir. He began by pointing out that guinea worm had actually been completely eradicated in Guinea. And when Bashir asked him, what did that have to do with anything, Carter said, well, there's a CNN reporter in the next room who's going to interview me after this meeting. It's up to you whether I tell him that you and John Garang have agreed to a ceasefire or that the disease has officially been renamed Sudan worm disease. And the guinea worm, the Sudan ceasefire took place, and in 1995, guinea worm ceasefire lasted long enough to be able to make a big difference in its eradication, and the cases of guinea worm dramatically decreased. Jimmy Carter would never have been able to act so boldly if he had not cared enough. But he didn't stop at caring enough. He also had to do enough. How many of you recognize the name of Dr. Mona Hanna-Attisha? Well, she's the pediatrician in Flint, Michigan, who sounded the alarm over lead in the city's water supply. When she found out that Flint wasn't doing corrosive control on its old pipes, she conducted a study to prove that the number of children poisoned by lead had doubled since the city switched its water supply. But she felt that simply submitting this research to a journal wasn't doing enough. She called a press conference, and the entire country knows what happened since then. Dr. Hanna-Attisha has now become, in addition to a pediatrician, an advocate for those children whose future was stolen by inequality. She's fighting to make sure that the young people of Flint benefit from every kind of service that can help them lead fulfilling and productive lives. Dr. Hanna-Attisha helped shine a light on the price that we pay for inequality. Of course, it wasn't sufficient for her to just do enough by simply calling a press conference. She was vilified and accused of causing hysteria, but she changed the life of a city and perhaps a nation because she persisted enough. I'm fortunate that in my line of work, I've been able to witness almost unimaginable persistence around the world. When I started my job running CARE, an organization that fights global poverty, One of the things that I did first was to visit Afghanistan and some of the schools we were helping to fund there. Even now, there are strong cultural forces determined to keep girls from going to school. That's why I was so amazed at the determination of the girls that I met who had decided to get an education no matter what. Not long after my visit, I read a story in the paper about two sisters, Shamsia and Atifa, who were walking down the street in Kandahar, a city in Afghanistan, when a man pulled up alongside of them and asked whether they were on their way to school. When they said yes, he sprayed their faces with acid. Shamsia's burns were so bad that she had to be taken out of the country for treatment. Atifa and Shamsia will be disfigured for life and marked by the trauma in many ways. However, when asked if she would stop attending school, one of the girls told a reporter that they could spray her 100 more times and she would still go to school. She said, "I want other girls to have the chance for an education." Shamsia told a reporter, "Why wouldn't I want to go to school? I want our country to persevere. I want to do something for my country. I must go to school." So care enough, do enough, persist enough. The legendary preacher Howard Thurman said, "Don't ask yourself what the world needs. Ask yourself what makes you come alive, and then go do that. Because the world needs people who have come alive." Come alive. That's an easy thing to say, an easy thing to hear, and an even easier thing to sometimes ignore. But Thurman meant something very specific by it. I hope very much that you never have to strong-arm a nation's president, that a frightened establishment never vilifies you, and that nobody ever sprays acid in your face. But when Thurman said to do what makes you come alive, he didn't just mean go do something that you like doing. He meant find what it is that you must do, no matter what it is that gets in your way, and do that. You've already dedicated yourself to health and healing. Now your task is to discover how to care enough, do enough, and persist enough to create a more just and equal life for everyone. Congratulations, class of 2016. The world awaits you. Thank you.
So I would like to thank Dr. Gayle for being here with us, for that phenomenal speech, and for your life's work that continues. And on behalf of the School of Public Health and Health Professions, I give you this plaque of appreciation.
Thank you. Thank you.
I would also like to note that tomorrow Dr. Gayle will be given one of the highest honors possible. She will be honored with a SUNY honorary degree, and that will happen at General Commencement tomorrow. So thank you, Dr. Gayle.
Thank you.